I was at the Congress now in Monte Carlo this weekend, and they were saying that cellulite is a disease. So you have to, you can't treat it. It's a whole disease due to decreased microcirculation, increased fat deposits, much thinner dermis of the skin, and that's why people get cellulite. And you can't believe how, like a thing like cellulite can affect a person. I had a patient about 2 weeks ago, before I left for overseas. She said to me that she did one of the treatments, and she said, you can't believe how it's changed. She said, I was depressed. I mean, can you believe a person can be depressed about their cellulite?
Oh, absolutely.
But she said, for 10 years, I've been desperate about my cellulite. I exercise, I eat well, I do everything correctly, but I just couldn't get rid of the cellulite. Look, we can never completely cure it, but you can improve it
tremendously.
And just having, like, be able to wear shorts. I mean, that's just all they want to do is put a pair of shorts on in a warm summer, and look great. Because some of these, some women with bad cellulite, it's just not on. You have to cover your legs. So cellulite can cause depression, and just you can't believe how it's actually improved how I feel about myself.
So I know that you listening to us out there and listening to Dr. Maureen Allem, many of you are relating to what we're saying. We would like you to call in and tell us your story. Now, sometimes people don't talk about this. It's your hidden secret. Your thought about wishing that you looked different, or this would change or that would change. Your belief, maybe. Perhaps it's a real belief. Perhaps it's a false belief. We're going to talk about that. This is worrying you. It's just an area on your body or on your face that continually worries you. And it might be that there is something that is relatively simple, not that complicated or invasive even, that might be able to deal with that problem. Could it be that if that problem was dealt with, you just might feel a little bit better about yourself, not unrealistically? And there are many of you who are listening who can relate to what I'm talking about. So you can join us in our conversation, 0861 242436, and we do want to know about what some of the treatments are, as well as the psychological side of it. We will be back with you. Don't go away. And you're back with me, Dorianne Weil. We're on the couch on 101.9 Chai FM, and we're talking about this quest for youth. What does it mean? We know, of course, we all want to look our best and to feel our best, but we also want to know that it's not just only for the outside. Why do we? What is it all about? Does it really make us feel better about ourselves? How does it affect our self-esteem? How does it affect our relationships? What about in the workplace today, where there's so much competition and people coming up, and you might be a man or a woman who might be in your 50s or certainly in your 60s, and you're kind of looking over your shoulder and you see this kind of younger lot encroaching on you, and you know that you've got the expertise, and you know that you've got the years of experience, and you know that you've got the wisdom, and you know that you can do an absolutely superb job, and you've got the creativity. And then you look in the mirror and you say to yourself, I've got everything, but I somehow feel that I might not have the look. And what is the look? And why do we value that look so much? And what can we do? And should we be after it? And what can we do? And what is out there that's available for us to achieve it and attain it, given the fact that we've already stated absolutely no doubt that we are all living for longer, which of course is the good news. We want to live our best lives possible. On the line, joining us in our conversation is a renowned plastic surgeon, certainly a well-known name in Johannesburg, in South Africa and internationally also, Dr. Richard Halley-Stott. Welcome to you, Dr. Stott.
Good evening, Dori.
Good evening.
Thank you very much. Good to join you, and good evening, listeners, and good evening, Maureen.
Hi.
Hi.
Good evening.
Hello.
Good evening. So, Dr. Stott, we're talking about the various procedures there are and how they affect people's psyche in terms of this kind of quest for youth. First of all, we know that sometimes people have expectations that are often met, and they're really delighted with the procedures that they have. We also know that there are perhaps a small but nevertheless a percentage of people who have unrealistic expectations of what certain plastic surgery procedures in particular, the difference that it's going to make to their entire lives. And they have this fantasy that if they just have a different body, or they have bigger breasts, or they have tighter skin, or they have that facelift, everything in their lives will kind of fall into place. What is your comment about that, and do you see those kind of patients from time to time?
Well, Dory, I must say that all the points you've been making as I was listening just before you got me on the line were absolutely on the button. I couldn't agree more about self-esteem and what have you. But this particular kind of patient that you're referring to represents a very small percentage of the patients who come to see one. Patients are very well informed these days. Magazines, they've often seen 2 or 3 doctors, discussed it with a dozen friends, and so forth. And they often know exactly what answers are expected of them. But it is the plastic surgeon's responsibility to find out what the patient is expecting and to give them realistic expectations. And if the procedure goes ahead and money is taken and surgery is done and you do not meet those expectations, you've done that person an enormous disservice. So it is very important that the what the patient is expecting is clear in the surgeon's mind. What the surgeon can do is clear in the patient's mind. This is terribly, terribly important before any kind of contractual connection begins between them.
So you would say that actually it might be not the most major part of your role or your expertise, but nevertheless a very important part is to do almost pre-surgical counselling first.
It's a completely critical role, and I would certainly expect this to be dealt with in any young plastic surgeon's training, and I would certainly expect any proper, decent plastic surgeon to go into all of this. Apart from anything else, if you are going to not meet people's expectations, I don't think you'll survive very long in private practice.
I've heard it said once. I'm trying to think of where. It might have been I think it was in Dr. Alan Widgerow's book, where there was that statement that he made. I think it was, I hope I'm not misquoting, that a plastic surgeon might make his living by what he does and might make a reputation by what he doesn't do. And what he
that could well have come from Alan, and I think that's very good. Mm-hmm. I could tell you numerous anecdotes about all this, but you must continue with your show.
No, we're very interested. You're very much a part of our show.
I'll give you an extreme example that comes to mind immediately. Mm. I had a fairly young woman for a facelift. She had very, very lax skin, and she really needed it, loose jowls and chin and all sorts of things. And it was a beautiful facelift. She walked into my rooms 3 or 6 weeks after the operation, and she looked gorgeous, and she said, "I'm absolutely devastated. My husband says I'm ugly."
Oh, goodness.
I said, "This is just not possible. Mm. You look superb. Mm. Everything's perfect." Mm. And I said, "No, there's a different problem here." So straight to your profession, we arranged for them to have counseling. And a few weeks later, she walked into my room again, radiant, happy, and said, "You cannot believe it. Thank you for sending us to counseling. We've unearthed a few problems. We've sorted them out. My husband thinks I'm beautiful. I've never been happier."